So when people think of evaluating any kind of initiative, what they typically are thinking about is outcome evaluation. But as we know from the last two videos we watched, that formative evaluation, the type of evaluation that goes into deciding how you're going to actually design or roll out a program, as well as process evaluation, the type of evaluation that looks at, was your program rolled out the way you intended to roll it out? That is also important. And we can't forget about that and just focus on short-term and long-term outcomes. But truthfully, when most people think of like evaluating a program, they're thinking about like, did it make an impact? And that's what outcome, also known sometimes as impact evaluation, looks at. Did it change things in a way that we think is acceptable? That's what proximal and distal impact evaluation looks at. So in the PRECEDE PROCEED model here, just to jump forward a bit, phase 6 and phase 7 talks about short-term and intermediate evaluation, and phase 8 talks about long-term evaluation. So this proximal evaluation, or the short-term and intermediate outcome evaluation, this looks at more like, well, proximal, close to, like the program just ended, let's say. Program just ended. Can we send out a survey that asks people about the change in their behavior or their perceptions of, changes in knowledge or skills? Or is there an objective way to measure some of these things? Like, was there a change in how many people took condoms from a particular place, or how much STIs were reported at a particular location, right? There might be some more qualitative and some more quantitative data that we collect about these short-term outcomes of this program. Like, did we change the thing we desired to change in the short term? Okay. So yes, this evaluation demonstrates the extent to which the program is having an effect on the target population and their attitudes, knowledge, and belief. Okay, so is it meeting its short-term goal? But if you remember with the PRECEDE PROCEED model, it's not just about like the change in behavior, but it's also about like that higher level value or higher level goal of that population. Like, what is the quality of life thing, the thing that is like so important or valuable to that group that you were hoping to change, maybe through a change in their behavior as well. So that's what outcome evaluation looks at. It's more long-term, more distal. That's what we call it, distal impact evaluation, right? So it assesses more of these ultimate program goals and objectives. So this is usually asked, distal evaluation, this might be done like a while after the program is over. So if I think of like our university, in BPK in particular, we do exit surveys with students where we ask them questions about their experience, or we do sometimes when there's the resources, where we ask students experiences about their BPK degree as they're leaving, right? So that would be a short-term evaluation. Like, did we have an effect on the things we hope to have an effect on while students were here, right? And then what we don't have great data on, which we'd love to have better data on, is like what's happening 5 years down the line. Like one of our goals in BPK is that students are, well versed for successful careers and to have positive influences on, biomedical physiology and kinesiology type things, and are people getting the careers and having the professional advancements, and are they having these outcomes that we think are valuable too? That would be like a long-term distal outcome, but we're not great at measuring that. We would have to like keep in touch with alumni better and have a way for assessing what we find is valuable, right? And what it would be an acceptable amount of change or influence, right, for us to properly assess the outcome. So proximal outcome evaluation, it happens like, if we're talking about a time component, it's like kind of right after the program ends, or slightly after the program ends usually. And did the program change the thing we wanted to change in the short term? Distal long-term outcome evaluation, that's like we're thinking down the line. Like, did cardiovascular disease rates drop? Did beliefs around smoking, mental models around smoking in the population, have those evolved, right, since we've run our program? Like I said, do BPK students, are they seen as leaders in the professional world with respect to health? Okay, so that's the big difference between proximal and distal, right? So when it comes to proximal outcome evaluation, and again, this is something that you want to discuss with your stakeholders, you want to discuss with your target audience, maybe some interviews in the beginning and some, expert consultation in the beginning, making sure that the right people are at the table and they have influence as well, right? What would be considered a success? If we're spending all this time, we're doing all these things, what would be a success in the short term? Like, you're not going to prevent cancer from happening in the short term, right? But can you make an appreciable change in smoking rates within this population in the short term? And then what would be considered an acceptable change in smoking behavior? So question one you want to ask with this proximal outcome evaluation is like, what data do you need? To see if there's a change, what pre-data do I need and what post-data do I need to tell me that yes, it was a success? And again, this is something you think about from the beginning, is how you design your study to collect this data that's going to help decide whether you had an appreciable effect. Okay, a lot of times we do employ non-experimental designs. In particular, we use surveys in order to determine, whether people believed that there was a change in their behavior, right? Experiments are harder to run with respect to health promotion strategies. We often use like quasi-experiments, so we might compare the group that had the intervention to a similar group in the population. So it's not a true control group, because they weren't randomly assigned, but we can use a comparison group to compare a population to. And then we can also collect qualitative data, we can do interviews, we can talk to people about their lived experience, we can collect case studies, we can do all these things to help gather information, again, about whether a program was a success or not. And again, this is something you think about earlier on. Once you're at the end of your study, it's too late to decide what data collection design you're going to use. Okay, so when it comes to distal outcome evaluation, like I said before, this is about the long-term effects. Did the intervention influence the larger issue you were trying to solve? Which again, is what you were going to identify in phase 1-ish of the PRECEDE model. So think long-term. This type of evaluation typically occurs after a program has ended, kind of long after, or a while after, often years after a program has ended, or if you've been running a program for a while and you want to see if there is a particular change in that group overall. So let's say you have a clinic, I'm thinking of the diabetes and obesity medicine clinic, and they've had a population where they've been running programs, health promotion related programs, for a long time. Have they noticed that people that participate in their program and stay in their program for a long time, do they have better health outcomes than the people that maybe don't stay in their program, right? Maybe they're continuously monitoring their program and they don't unfortunately have the resources to continuously do that, but maybe they're doing that to say, like, are we actually making a change in the thing, in like, let's say obesity, in the thing that we care about changing? Okay, that is more distal, like long term. Okay, so was there a change in an ultimate goal, right? How will you collect this? Do you need hospital data? Do you need another survey of some kind? Maybe some community data, like the Canadian Community Health Survey? Or do you need to keep in touch with your population? Like, do we need to keep in touch with their alumni and follow up with them? So this slide, like we saw before in the process evaluation module, gives you some ideas of like some strategies that could be used to gather data about whether your program had an impact, distally or proximally or distally, in the short term or in the long term. So one of the best strategies we have is to compare people before and after, right? And with a proximal evaluation, outcome evaluation, we might compare people before the program to after the program. Whereas in more distal evaluation, we might compare people, distal outcome evaluation, we might compare people before the program to 5 years after the program, or from right when the program ended to 5 years down the line, or 2 years down the line. And there's different quantitative and qualitative analytic strategies you can use, different statistics that you can use as well to show, to be able to show, and then especially to decision makers, whether your program was successful in the short term and in the long term as well. So I've kind of glazed over evaluation strategies. I've been more focusing on like differentiating between formative, process, and impact or outcome evaluation. But in the next module, I want to start looking at like what strategies do we have to evaluate these programs. And I also want to talk about standards of acceptability and how we decide on what to evaluate as well. So I will see you in the next video.